So we'll just skip through a few of these slides quickly here. So I have no disclosures, and my objectives have been posted in a few different locations. So we'll start here. So we're going to talk about TB infection and epidemiology of TB infection in Washington today. And I guess I first just want to thank everyone for all the work that you do, because we're able to talk about TB infection because of the work we do around TB cases and really initiating treatment early and doing thorough contact investigation. So if it wasn't for that, we actually wouldn't even be here today. And I think you're probably all very familiar with the infographic there on the left. This is our tip of the iceberg infographic. As we know, that tip of the iceberg really is our TB cases. And when we talk about TB infections, everything underneath the water. So really a massive amount. We know that around a quarter of the world's population is infected with TB according to the most recent models. And that comes down to around 13 million people in the United States. And we now have new numbers that show us around 200,000 people in Washington are actually infected with TB. So where did that come from? So last year, an epidemiologist, Maryam Haddad from CDC, published this paper, and it's the simple estimates for local prevalence of LTBI infection in the United States from 2011-2015. And in addition to publishing this paper, she actually talked with all the different states in the US and provided kind of some state-specific numbers and actually county-level specific numbers. So we have, for everyone in Washington, we have county-specific LTBI numbers in both US-born and people who are not US-born. And also, so if you're participating not from Washington today, this is actually available in your state as well. So she did this for Alaska and Idaho, Oregon. So work with your programs, or if you're welcome to work with me to get this information, or reach out to Maryam Haddad herself, and I'm sure she'd be happy to get you that information. So I'm going to show you, I kind of talk about her methods. I'll show you this because it's a little prettier to look at. So this is actually, again, these are the county level estimates for the entire United States. And what she did was she took genotyping data and said that if you are somebody with a unique genotype, you probably got infected a long time ago, maybe as a child before you came to the United States. And when you develop TB disease, that's why you're unique, because you match people who were back in the Philippines or back in Vietnam. You don't match anyone here. You didn't get TB from someone in the US. If you were recent transmission, so maybe you matched several other people, they were actually thrown out of this and not really considered to be someone who was in that LTBI state for a long period of time. So then with that genotyping information, they also then applied what's called the annual risk for progression. So this was something that's been established in other papers, and she used the annual risk for progression to be 0.1%. If you use slightly different numbers, you're going to get obviously pretty big ranges, so we're looking at big numbers across the US. And they applied that to, again, those unique cases, those ones that they thought have actually been infected for a really long time. And they did a back calculation. So we're going to kind of look at it a little bit here. This comes directly from what's called the Tuberculosis Genotyping Information Management System. This is something that we have access to. I know King County does. If you're in Washington and are interested about getting direct access to this as well, please let us know. It's something I know that Sean McBrien's interested in doing. And what it can do is it can show you of your cases that have culture positive, what those genotypes are. And it actually has this report in here that actually will give you an estimate of your recent transmission. And there's a lot of little caveats, because again, this is a model, these are estimates. There's a lot of little limitations to these numbers, but again, this is kind of our best guess estimate. So I'm going to focus your attention on the bottom line, which is the Washington. So this is from 2016 to 2017. We had 319 cases that were culture positive and genotyped. Of those, they actually calculated around 23, or only 7.2% were attributed to recent transmission, meaning that around 93% of our genotype cases were thought to be basically from LTBI, that long-standing LTBI in the community. Okay. So when Maryam did her calculation, she provided us with 3 different maps, and here's the first one. And this is looking at both our US born and our non-US born individuals divided into 4 categories. So we can see, again, the darkest color is over 3% population with TB infection, all the way down to 0 or less than 1%. Here. And this is actually in line with NHANES estimate. So our overall state LTBI prevalence rate was 2.9%, and the national estimate is 3.1. So we're a little bit under what that national estimate is. And if you break it down, stratified by US born and non-US born, again, it's 0.7% for non-US born in Washington, and 18.7% of people born outside the United States are estimated to have TB infection in Washington. So the next figure, again, you notice that the bar on the bottom there actually changed, so we're looking at a smaller scale now. And this is just looking at people who are born in the United States and looking at transmission. Again, the underlying numbers here come from our genotyping data, which shows us who has a unique genotype, and then they did that back calculation looking at just 0.1% of the total population of that county to determine what they thought the rates were. So the median for Washington was actually 0.6%, and it ranged from 0.0 to 2.6. So a little bit smaller numbers for sure. And this one I think is maybe my favorite and the most interesting, and this is looking at those who were born outside the United States only. And so again, our scale has changed at the bottom, so we're now ranging from 0 to over 15%. The median was 12.2. And you can see again where our dark counties are there. I think I've reached out to a couple of you to talk about kind of this. And we actually have specific numbers we have for US born, non-US born, and combined for every single county. So if you're interested in getting those numbers, please reach out to me, and I would love to get them for you. They also then, of course, apply that to your population. You can actually count. So maybe if you're trying to go to your board or something, you can actually tell them this is the estimate of LTBI in our community. Which is, I think, pretty exciting. And, you know, we know that Washington is home to a very large, diverse population. And if you look at immigration numbers for Washington, our top countries are Mexico, Philippines, India, China, and Vietnam. And if you compare that to our actual cases, so this is from Sean McBride, our EPI, looking at our cases 25 to 26, 17, and you'll see almost the exact same cases for TB disease. So again, when we think about our population not born in the United States, these are really the countries that we're looking at. That doesn't mean that somebody who's coming maybe from Ukraine or something, we don't have to worry about TB. But when you're seeing these countries, I think it's important to think TB. Okay. So I think I just wanted to share with you a couple of tools really quickly. This tool here that's on our website was adapted from the California Department of Health that helps us look at who to test for LTBI in our community. It focuses, again, on birth or travel and residence to country with elevated TB rate for at least 1 month, immunosuppression, both current and planned, and close contacts. This was all based on epidemiology. So when we're thinking about TB, again, we are really using our epidemiology to inform those decisions. Again, we've been talking mostly today about these people who were born outside the United States, and it was kind of tiny, so I threw that up for you there. The other tool I wanted to point you to in terms of trying to learn more about your community is really, I picked SOCAN here. This is the American Fact Finder. You can go on and you can Google American Fact Finder, and you'll see a little, it'll come up with a search box, and you can type in wherever you want, if it's Spokane County, or you can obviously do it for Anchorage, anywhere you want. And then you see on the left there, I had the option to choose origin and language, and then it came up with what they're calling foreign-born population is, and several different categories that you can choose from in that area there. And then so it's going to give you a lot of information, sex, age, it's going to give you, employment status, education status, and it goes on, and it breaks it down by, you can see on the right side there, people who were born in the U.S., people who weren't born in the U.S., and it actually breaks it down even further to really kind of learn about your community. And I think this is a great resource for us all to kind of look to when we're trying to determine, who do we need to be screening in our community. So again, please reach out to me. if you're looking for specific numbers for your county, I'd be happy to send those to you. I might actually, if I can get around to it, send them to you even if you don't ask me for them. So you have that information going forward. You can use that kind of when you're making decisions about how to prioritize within your community. So that's all.